First it was Wuhan, then Italy and Spain. Now the decisions to lock down cities has reached the United States, with New York and Los Angeles shutting down bars and restaurants and some schools. Now it follows a surprise announcement by the US Federal Reserve on Monday that it was cutting interest rates and injecting billions of dollars to encourage spending. Despite this, Asian markets have closed down, and there have been sharp falls too on the European market since opening. The French government has warned the situation there is deteriorating very fast. It is considering whether to now follow Italy and Spain into lockdown. We do have some good news though. In Seattle, the first human trial for a potential coronavirus vaccine is starting later.
Contagious.
And I haven't touched my face.
Trouble for the airlines this morning. EasyJet warning that the coronavirus crisis could result in it grounding the majority of its fleet. And IAG, the owner of British Airways, says it'll be cutting its capacity by 75% in April and May.
EasyJet, it says European aviation faces a precarious future, and there's no guarantee that the European airlines, along with all the benefits it brings for people, the economy and business, will survive what could be a long-term travel freeze and the risks of a slow recovery. Whether it does or not will depend significantly on European airlines maintaining access to liquidity, including that enabled by governments across Europe.
There have been a further 14 deaths, since yesterday from COVID-19. 35 patients who've tested positive for the virus have now died. The Department of Health says that's across the UK. That's up from 21 yesterday.
And I want to congratulate the Federal Reserve. For starters, they've lowered the Fed rate from what it was, which was 1 to 1.25, and it's been lowered down to 0 to 0.25, 4.25. So it's 0 to 0.25. That's a big difference. It's quite a bit.
The thing is that you stay at home.
Has now become the epicenter of the pandemic, with more reported cases and deaths than the rest of the world combined.
On leur a dit simplement, ça c'est plus possible parce que c'est idiot. Vous êtes en train de commettre des erreurs. Parce que vous exposez mutuellement.
I've got to be clear, we've all got to be clear, this is the worst public health crisis for a generation.
Doctors in northern Italy on the front line of the virus outbreak. In just a few weeks, the normally well-resourced health service here has been overloaded, with huge demand for intensive care. Ventilators are one of the key pieces of equipment critical care doctors use. They blow air into the lungs, keeping patients alive. The government has called on manufacturers to step up production of them for the NHS, but intensive care doctors say that could be easier said than done.
We're asking companies here to produce ventilators in double quick time.
The city that never sleeps is waking up to a new reality. Late on Sunday night, the mayor of New York tweeted that nightclubs, cinemas, theatres and concert venues in the city must close. Restaurants can serve takeaway food only. And then the mayor of Los Angeles announced the same. Two of the world's biggest cities are bracing themselves. For the second day running, Donald Trump gave a live press conference from the White House. Minutes earlier, the US Federal Reserve had cut interest rates to almost zero.
It's really good news. It's really great for our country. It's something that we're very happy.
And then the president, in his own style, urged Americans not to panic buy food.
I would like to say that people shouldn't go out and buy. We're going to all be great. We're going to be so good. We're going to do what's happened with the Fed is phenomenal news. What's happening with all of these incredible companies is phenomenal news. But you don't have to buy so much. Take it easy. Just relax.
President Trump declaring a national emergency over coronavirus in order to expedite relief, aid, and testing to states. Nearly 3,000 cases in 49 states. So far, West Virginia is the only state not reporting any cases of COVID-19. At least 57 Americans have died as the House passes a bipartisan aid package to ease the economic fallout.
Walmart said that they're buying more than they buy at Christmas. Relax. We're doing great. It all will pass.
Prefer a 14-day just sort of national shutdown to slow this down?
You know, I would prefer as much as we possibly could. I think we should really be overly aggressive and get criticized for overreacting.
Okay. Should more Americans be prepared to be hunkering down at their house?
I think Americans should be prepared that they're going to have to hunker down significantly more than we as a country are doing.
To get out there on something not related, at least to the White House directly, and that is the Federal Reserve. According to the New York Times, the Washington Post, the Wall Street Journal, looks like this was coming off an embargo right at 5 p.m. has just announced that they're further lowering their interest rates in the 0 to 0.25 range, essentially bringing interest rates all the way down to zero. That is a remarkable emergency move by the Federal Reserve. It gives you an indication of how concerned they are about what's happening in the economy. And there's also some assets purchased in there, which not to wonk out too much, but is known as quantitative easing. I think the Times put it at 500 to 200 billion.
Gatherings of over 500 people. What we're talking about here is sporting events, cultural events, events that a club or an association might run, all of which are not essential. Big conventions, for instance, at the Melbourne Convention Centre or other similar venues, if they are over 500 people and they are not essential, and there are clear definitions about that, then they are not to go ahead.
Hospitals bracing for a potentially overwhelming surge of patients. Healthcare workers worried about a shortage of supplies, especially masks. The U.S. with a stockpile of about 12,000 ventilators. The call going out for President Trump to use the Army Corps of Engineers to quickly create new medical facilities. Here's ABC's Marcia Gonzalez.
Tonight, with the number of COVID-19 cases rising, hospitals across the country preparing for a potential crush of patients. Some constructing tents to handle possible overflow. Health officials working around the clock on plans to keep the healthcare system from being pushed to the limits.
If we have a worst-case scenario, we've got to admit it, we could be overwhelmed.
Think about it, the coronavirus crisis is changing so fast that these maps can't keep up. The great shutdown of 2020 is underway. We know the hospital surge is coming. Preparations are underway in cities like Seattle. Unfortunately, it's like the arrival of a hurricane 100 years ago, before radars and satellites, when people would just feel the rain start to fall and feel the wind start to pick up, but no one knew just how bad it would be or for how long. That's what this kind of feels like. And let me just say, the news coverage should reflect those facts. These kinds of maps are important because it shows how many cases have been identified, but we also need to reflect the fact that no one knows the total actual number of coronavirus cases in the United States or elsewhere in the world.
Tonight, chaos at America's airports, travelers rushing home, worried about President Trump's new European travel ban. Images health officials would rather not be seen. You see it here, hundreds of travelers crowded on top of each other at Chicago's O'Hare Airport awaiting medical screenings. The president today defending the process.
States of emergency across the nation as a number of coronavirus cases soars above 3,000. Tonight, elected officials taking unprecedented measures to keep people safe. Illinois and Ohio closing all bars and restaurants beginning tonight. California shutting down bars and wineries and asking those 65 and older to self-isolate.
We recognize around the rest of the world that we need to meet this moment head on.
New York City Mayor Bill de Blasio closing all New York City public schools, affecting more than 1 million students starting tomorrow.
There is a real possibility that by closing our schools now, we may not have the opportunity to reopen them in this full school year.
France and Spain are following Italy's lead, putting a halt to normal life as the spread of the coronavirus accelerates in Europe. France announced Saturday that it will shut most shops, restaurants, and entertainment sites from midnight on Saturday, urging people to stay home as much as possible. French officials said more than 90 people had died in France and almost 4,500 were now infected, with the French Prime Minister saying the government had been left with no choice because too many people were still out in the streets and not doing enough social distancing.
Testing is emerging as one of the biggest issues of the coronavirus response so far.
If you piece together what happened, it's clear that it was bureaucratic bungling that caused the problem. The president, who identified the problem and insisted it was fixed, and the private sector that is now actually fixing it. Here's the timeline. In January, China published the genetic code that would enable a test to be built. Within days, the Germans had built one. The WHO adopted it for worldwide use. The Australians built one too, and that one worked. Our CDC built their own, and it finally went out on February the 6th, about a month after the German test. But ours didn't work. On February the 12th, it was recalled. More time went by. University labs and the private sector were begging to make a test. The FDA, the Food and Drug Administration, said no. Finally, at the end of February, once the president intervened, the red tape was swept away. A few days later, he ordered an overhaul of the testing approach, and on Friday he announced a testing partnership between the government and the private sector.
1 week ago, we were reporting 19 deaths, 490 infected. Today, the count is at least 60 deaths, almost 3,000 infected, and you say, as we heard, that the virus may continue to get worse for another 2 months. There have been estimates of hundreds of thousands of people in the U.S. who could die, or in the worst case scenario, millions. Can you tell the American people that that is possible?
You know, it's possible because when you do a model, you have a worst case scenario, the best case scenario, and the reality is how you react to that will depend where you're going to be on that curve.
There have been no data regarding COVID-19 as its relation with the weather issue. But if we take a look from the past experience of SARS, which was another coronavirus, we will be able to see that the factors that influence the rates of infection actually are multiple factors. For example, including the gradual loss of virulence with the time progression, or regain of virulence because of mutation, and other joint measures of prevention and control, etc. Among them, unfortunately, the impact of weather hasn't been confirmed yet.